If you've recently been diagnosed with diabetes, and specifically type 2 diabetes, and you're wondering what that means, you're in the right place because this video is for you. The fear of the unknown can be very difficult, especially with a new medical diagnosis. In today's video, I'm going to try and help with some of those fears and eliminate them by answering some of these very common questions. Number one, what is type 2 diabetes? Why is it different than type 1 diabetes? Number two, what are the risk factors for type 2 diabetes? And why might I get it? Number three, what are the symptoms of type 2 diabetes? What should I be looking for? Number four, why is it so important to manage type 2 diabetes? Or in other words, what bad can happen if I don't address it? And number five, finally, what are the treatment options, both medical and non-medical treatments? Hi, I'm Dr. Brian. Type 2 diabetes is a disorder that disrupts the way the body uses sugar, and it's sometimes called type 2 diabetes mellitus. Diabetes is Greek for siphon, and it means to pass through. Mellitus means sweet, and so the name refers to what happens in uncontrolled diabetes, which is the passing through or urinating of sugar. This is because in diabetes you have a large amount of sugar in your blood, much of which you pee out, and so your urine is sweet. All of the cells in the body need sugar to work. After you drink, after you eat, your body will digest this and convert it into sugar, specifically into a molecule called glucose. And this glucose goes into and circulates throughout your bloodstream. Then these glucose molecules have to get inside cells to work, but they can only get into the cells with the help of a hormone called insulin. Insulin is made by an organ in the abdomen called the pancreas. The relationship between insulin and your cells is like a lock and key mechanism on your front door. Sugar or glucose circulates in your blood and it knocks on the front door of all the different cells. But the only way the sugar can enter through the door is if insulin unlocks the lock on the door. Then the sugar can pass through the door and get into the cell. Once in the cell, the glucose or the sugar is used as an energy source for your normal body function and activities. But in diabetes, the lock and the key process doesn't work correctly. If there's not enough insulin, then there aren't enough keys to unlock the doors, and the cells can't get enough sugar. This is type 1 diabetes. But in type 2 diabetes, the problem isn't with the key or the insulin, it's with the lock on the cells. There's initially plenty of insulin, but the lock on the door doesn't work. And because the cells in the body don't respond normally to insulin, the sugar builds up in the blood. This inability for the cells to take up sugar, even though there's insulin, is known as insulin resistance, and it's the hallmark problem in type 2 diabetes. Contrast this, in type 1 diabetes, the pancreas makes little or no insulin, so this requires insulin injections. But in type 2 diabetes, initially the pancreas still makes plenty of insulin, but the cells in the body stop responding normally. Pancreas eventually can't keep up, it burns out, and even in type 2 diabetes, there's not enough insulin. So what are the risk factors for type 2 diabetes? What do you need to be on the watch out for? Family history. Family history is a big one. Compared with individuals without a family history of type 2 diabetes, individuals with a family history, that is any first degree relative, have a 2 to 3 times increased risk of developing diabetes. And the risk of type 2 diabetes is higher, that is 5 to 6 times, in those with both a mother and a father or a maternal and paternal history of type 2 diabetes. So your lifetime risk of developing type 2 diabetes is 40% if you have one biologic parent with type 2 diabetes and 70% if both of your biologic parents have it. In identical twins, which is known as monozygotic twins, if one twin has type 2 diabetes, there's a 90% chance of the other twin developing diabetes over their lifetime. So far, there are at minimum 150 genes that have been identified to be involved in the development of type 2 diabetes. The second major risk factor is obesity. Studies have shown that most people who have type 2 diabetes are overweight or obese. Now, you're overweight if your body mass index is between 25 and 30, and you're classified as obese if your body mass index is higher than 30. A detailed analysis of studies from the United States and Europe have found that compared to people in a healthy weight range defined by BMI, obese men are 7 times more likely to have type 2 diabetes, and obese women are 12 times as likely. And it's not just being overweight or being obese, it's also the fat distribution. There's what's known as centripetal obesity and peripheral obesity. A simple way to look at this is what's known as the apple versus the pear model. Centripetal obesity is a round apple shape where the fat is deposited centrally. Peripheral obesity is where the fat is deposited lower, hips and lower. And this is really defined by the ratio of the waist to the hips. And the incidence of type 2 diabetes are highest in those subjects with the central or the apples type of abdominal obesity. Having excess body weight or being obese definitely increases an individual's risk of developing type 2 diabetes. The good news is that with weight loss, that's 5% loss of body weight can improve your insulin resistance and reduce medical requirements in type 2 diabetes. For example, the average woman in the United States is about 5'4" in height. If you take a 5'4" woman and she's overweight, she weighs 220 pounds, which is a BMI of 38, and she loses 5% of her weight, that's 11 pounds. So losing 11 pounds can markedly help her type 2 diabetes management. Now that level of weight loss is actually realistic, even long-term, especially with some of the newer medicines. And if medical therapy fails, in extreme cases, bariatric surgery has been shown to be very effective for type 2 diabetes as well. Now the third risk factor is sleep duration. There's a meta-analysis of 10 prospective studies that looked at individuals who slept 8 hours a day, or those individuals who slept significantly shorter, 5 to 6 hours a day, or those individuals who slept significantly longer than 8 hours a day. The duration of sleep was significantly associated with an increased risk of type 2 diabetes if it was either shorter or longer than the 8 hours. Very interesting. So let's move on to what are the symptoms of type 2 diabetes. What should one look for? Type 2 diabetes is very common. More than 37 million people in the United States have diabetes, 1 in 10 people, but 90 to 95% of these people have type 2 diabetes. And the symptoms of type 2 diabetes often develop very slowly. In fact, you can be living with type 2 diabetes for years and not recognize it. When symptoms are present, they may include the following: increased thirst. This is known as polydipsia. Peeing more frequently. This is known as polyuria. Feeling hungrier than usual. Having regular fatigue. Slow healing of cuts and sores. Tingling or numbness in your hands or feet. This is known as neuropathy. I used to see a large number of patients in one of my clinics, and they would come to my clinic because they felt they had something wrong with their veins and that they had varicose veins or something wrong with the blood vessels in their legs, and in particular because their legs or feet, toes were hurting them. It was very, very common that after working through this and working them up, these individuals actually had type 2 diabetes and had it for years and were now getting what's known as neuropathy, or nerve changes in the nerves in their toes and their feet. And it was completely unrecognized until they appeared in my clinic. So can type 2 diabetes lead to other health problems that are important? Yes. Type 2 diabetes might not initially make you feel sick, but if it's not managed, it can lead to catastrophic and serious problems over time. These include everything where blood vessels are important, which is almost everywhere, including the heart, the kidneys, your legs, your arms, your eyes, and your brain. Individuals who have type 2 diabetes for long time periods have twice the rate of heart attack, twice the rate of stroke as those who don't have diabetes. They have chronic kidney failure in about 40% of people who have type 2 diabetes. As I mentioned, vision problems and even blindness can be very common. The neuropathy, where you get initial pain, tingling in the feet, and it can then progress to numbness, can really be a problem because then individuals don't recognize when their feet have small sores on them. These can get infected, oftentimes leads to progressive amputation, first of toes, then of feet, and sometimes even of whole legs. So it's very, very important that once you've identified that you have type 2 diabetes, that you manage it appropriately. So after hearing all of this, what do you do if you suspect you might have diabetes? How do you get it diagnosed? It's fairly straightforward. A doctor or your nurse can do a blood test. There's two different kinds of tests. One is known as a fasting glucose test, where after not eating for 8 hours, they take a single sample of your blood and look at your blood glucose level at one time period. That works pretty good, but there's a fair amount of things that can change that. A much better test is what's known as a hemoglobin A1C. It can be checked at any time of the day, even if you've recently eaten. This is a much better test that shows what your sugar levels have been for the last 2 to 3 months, and it's a much more reliable test for diabetes. And finally, if you do have type 2 diabetes, how is it treated? Well, the good news is, although it can't be necessarily cured, it can be managed, and especially reversal is possible. The goals of treatment are to manage your blood sugar immediately and every day so you can lower your long-term risks of those serious future problems that I mentioned before with your heart, your limbs, your kidneys. And treatments include, first of all, lifestyle changes. This is an important part of managing diabetes. It includes changing your eating habits, especially eliminating high sugar content foods like sugary drinks, soda, fruit juices, and getting plenty of physical activity. Exercise increases your cells' ability to take up that sugar or glucose that's circulating throughout your blood system. There are really good medicines available for both sugar control and weight loss. For sugar control, most people will need to take some pills that will help the body keep the sugar levels down. It can help increase insulin or help insulin do its job by making cells more responsive to insulin. The main medication that most people start on is known as metformin. Other individuals, especially later, will still need insulin shots, and depending on what medicines you take, you might need to check your blood sugar regularly at home, although not everyone with type 2 diabetes needs to do this. For weight loss, there are game-changing drugs now available. There's Ozempic, Wegovy, and Mounjaro. These reliably can lead to 10 to 20% of body weight loss, and there are some really good scientific studies that show in adults with obesity that these medications can decrease body weight loss by 15 to 21%, and in the larger of two trials, over 80% of participants lost greater than 50% of the body weight, which, as I mentioned earlier, can really give a significant benefit for managing your type 2 diabetes. Sometimes people with type 2 diabetes also need medicines to help prevent problems caused by diabetes. For instance, medicines used to lower blood pressure that can further reduce your chances of heart attack and stroke. And then there's general medical care that you need to take care of, whether you have diabetes or not. This includes watching your blood pressure, watching your cholesterol, getting appropriate vaccinations for flu, pneumonia, COVID. That's type 2 diabetes. Thanks for watching. Please don't forget to subscribe.